Someone recently told me about a conversation they had with Social Security because this person was wanting to sign up for Medicare. And this person was older than age 65 because she had continued to work and was covered by her employer insurance. And Social Security told her that she couldn't do it until she retired and quit working. And that was not correct. That is incorrect information. They also told her she had a 3-month window to sign up, which also was incorrect. So the question is, does Social Security make mistakes from time to time? Well, of course they do. You have to remember that Social Security employs nearly 60,000 people nationwide, and people are people, and people make mistakes. You know, there might have been someone new that just gave an answer without looking it up first. So what's the real answer to that question? When can you enroll in Original Medicare? And there are 3 enrollment periods. We're going to go through them one by one. They're called the IEP, Initial Enrollment Period, SEP, which is a special enrollment period, and the GEP, which is the general enrollment period. Don't get confused. This is really, really simple. So here we go. The IEP, or initial enrollment period, is when you turn 65 and you've qualified because you worked for a minimum of 40 quarters, that's 10 years, or you married someone who did. You can also get it through because your parents had worked 40 quarters. But generally, you qualify for Medicare, you turn age 65, that's your initial enrollment period. It's 7 months, 7 months, not 2. It's the month that you were born, and then the 3 months before that, and then the 3 months after that. I'm not sure if I did that left and right, reverse here in the video, but you have a 7-month window to enroll in Original Medicare when you are going on at age 65. That's the first enrollment period. The second one is called the SEP, Special Enrollment Period, and generally that is for people who have worked past age 65. And they have insurance through their employer, and that employer has 20 or more employees. So 2 conditions have to be met. You're still working and still covered by your employer insurance. And typically it has to be an employer with 20 or more employees to be considered creditable. That's the special enrollment period. It lasts 8 months. When either one of those 2 conditions drop, you quit working or you lose that employer coverage. For a lot of people, it's at the same time. Then you can enroll. We create a special enrollment period. Now, you don't have to quit working. When you're beyond 65, many employers will just say, okay, we're going to let you go on to Medicare, and we'll cut off your employee insurance. So you've lost the insurance. You still have that same 8-month window. Either condition drops, but you can enroll in Medicare after age 65. You do not have to retire. But whenever your employer insurance quits, then you have to enroll because you could be assessed a late penalty if you don't. The third enrollment penalty is called the general enrollment period, the GEP, excuse me. And it only exists because you missed both enrollment periods, the initial enrollment period or the special enrollment period. That's a tongue twister. When you miss those, then you have the general enrollment period, and it runs from January 1st to March 31st. So that's a 3-month period. Whichever of those 3 months, and it's every year for people who miss the other windows, it's January through March. Whichever month you sign up in, your Medicare coverage starts the following month. So that's how it works. Just a reminder, yes, sometimes Social Security makes mistakes, but those are the facts on how you enroll in Original Medicare. And by the way, I forgot to mention something. If you have retiree coverage, COBRA coverage, things like that, those do not count as creditable coverage. You have to be actively working and actively enrolled in current employer insurance. When one of those ends, that's when your 8-month clock starts ticking. If you have any other questions, feel free to reach out, email, text, phone call. That's what we're here for. We exist to answer your questions. Thank you, and hope to talk to you soon.